Hi, I'm Dr. Manisha Rafian, MD. We're performing a test called the EMG and nerve conduction test. This patient has back pain with a pain that radiates down his leg, so we need to rule out if there's any pinched nerve or radiculopathy. So we are setting our device and putting our electrodes to the body parts, and then we're going to start doing the testing. So with the distal part of the leg and proximal part, and we got our response. We're going to turn him over and do the rest of the testing. I feel a little tiny shock there. Okay. Then we go proximal. Do one more. Okay. All right. So I'm gonna go to the opposite leg. So we're going to stimulate the nerve. And we're going to go proximal. Alright, so we've done with the first part of the exam, which was the nerve conduction studies. What we're going to do is do the needle EMG exam, in which we use a small needle to go to the muscle to look at the electrical activity of the muscle to make sure we're not dealing with a pinched nerve. So you're going to feel a little tiny poke, okay? There you go. Press on my hand. Empuja con su pie. Otro lado, así. Más. Este lado. Okay. I use a different muscle now. Empuja su mano. Con su pie. Otro lado. No, en gas. Pero es que gas. Ahí. Okay. We're going to do one in the lower back, sir. Okay. We just complete our study. To the stick. More. So we're just sampling the muscle fibers to see if there's any abnormal potentials there. You hear some noises there. Su pie para arriba. Un poquito más. Más. Okay, that's okay. So we're done. Electrodiagnostic medicine studies, or EMG and nerve testing, is a very powerful testing that can tell the physician whether the problem the patient is having causes the actual nerve damage that innervates the specific muscle group, or if there's any nerve damage, such as patients that have diabetes or peripheral neuropathy. By this test, you can detect if there's any pinched nerve or any specific nerve damage to a specific body part. This test is very objective, but it does require to some degree the patient's cooperation. If it's done correctly, it's a very powerful objective testing to detect nerve and muscle tissue damage. The specific machine that we use is a brand new machine called Sierra Wave 2, made by Cadwell. The machine is very sophisticated. It has multiple programs, and it can allow the physician or electromyographer to go to different settings to further detect the very minute nerve or muscle tissue damage.